My name's Rachel Turley. My husband is Ryan Turley, and we have 5 kids.
I serve with Rachel, with my wife Rachel, on the advisory committee that organizes the Stars of the Season event that every year raises money for the Carden Children's Hospital. And this year that money is going towards the NICU.
So my first set of twins, they were born at 36 weeks. I had a son and a daughter. My son had some complications. He was taken to the NICU and put on oxygen. His blood sugar level was low. He had an IV, so he was put in an incubator, and that was hard. I didn't get to hold him or see him for a couple days.
It was hard having everyone separated. I didn't really know what to do. You know, my wife was in one place. My daughter, she could come to the room occasionally. And my son was up at the NICU.
My second pregnancy was a little more complicated, actually. My daughter Lizzie, she actually was a twin. Throughout the pregnancy, I came in. They would monitor me very closely, trying to figure out why one baby was thriving and the other one wasn't. Finally went in and there was no heartbeat in the second baby. Miraculously enough, my daughter Lizzie, she was born healthy and safe. My third pregnancy, Jill and Julia, both immediately taken to the NICU, and I went home without them. My husband would go in and visit me and then go up and try to help care for the babies.
It would have been great to be able to have one place where we could gather as a family.
Very, very close relationships develop between the parents and the nurses. And one of the things we've learned over the years is that we need to engage the parents more and more as the babies get closer and closer to discharge. The purpose of the funds that are being generated this evening at Stars of the Season is to expand our individualized space for parents with their babies, with a place for the parents to sleep, the baby to be monitored and cared for.
Parents who have a baby that comes to the NICU, this isn't their dream experience.
It would have been nice if maybe we would have had a room where we could all be together as a family.
I think it's critical because if the family isn't there, then one, they don't have the opportunity to bond with the baby, but secondly, they don't get to participate in the care. And for us, that means defining what does the family need. This isn't our definition of family-centered care, it's really the definition from the family. We designate primary nurses, so they'll stay with the family during their whole visit. They develop a relationship with them.
All of my kids, miraculously enough, are healthy and safe.